of them seriously. So tomorrow the world you can see. And if you are an inheritor of some IDs or disorder, then check a doctor regularly. So for a longer time you can see.
Greetings, good people. Welcome to another special edition of the program I Care. I Care, your business, my business, and everybody's business. This is the second in the two-part series organized by the Trinidad Eye Hospital. Thanks for their sponsorship. Of course, in collaboration with Mended Studios, the platform which you are now tuned into, and of course, PAVI, persons associated with visual impairment. It's a partnership that's working together, growing together, and getting things done. It's on the program today. Strange enough, we're going to be talking about something called diabetes. November is the month for diabetes around the world. And coincidentally, World Diabetes Day was last Saturday, the 14th of November. And I want to introduce my guest here because he is Dr. Kumar. And Dr. Kumar, he spent his first Diwali here in Trinidad. And before we came on air, we were talking about all the nice goodies and stuff like that. But, you know, overdoing it, Dr. Kumar, could lead to problems. Good afternoon and welcome.
Thank you very much. Thank you very much, Mr. Prasad. And it's a pleasure to be out here and share this space with you all.
Right. So what we will do right about now is to take a quick break, come back in. We will have a session for you to call, 337-6709, later in the show. But Dr. Kumar and myself will be exploring all the intricacies of diabetes. And when you call, please note the doctor is not going to diagnose you on air. You will have to visit the eye hospital to get that diagnosis. But we can talk things in general during the calling segment. So in the meantime and between time, let's take a quick break. We'll be right back with you.
Courtesy is a presentation of Persons Associated with Visual Impairment, Episode 1.
Gosh, boy, like we late. Let me go and sit down quick, eh?
Wrong seat, son. Wrong seat.
Oh, gosh, man. When will you learn to guide me properly, boy? I tell you. When we enter a room, give me the heads up. Tell me how the chair is situated and guide me to one. Put my hand on the back of the chair so that I could check to make sure it's safe to sit down on the chair. Look how you make me sit down on your man lap.
Me partner, don't blame me now. It's you play Mr. Punctual and hurry to run and sit down. Anyhow, one good thing I could say, you would have the best seat in the room.
This is so embarrassing, eh?
Okay, welcome back. Very positive and powerful message there. You know, when you're leading blind persons, you have to lead them properly. Like I said, today we're talking diabetes, and Dr. Kumar is the guest, and I am going to guide you through the process in terms of the discussion. Diabetes is a major eye condition, well, a major condition around the world, and it can lead to many things, including loss of limb and especially problems with the eyes. Doc?
I'm here, Mr. Prasad. So please go ahead. Ask me any questions or what I
Yes,
could
of
answer.
course. Now, let's look at stats first, Doc, because the prevalence of diabetes is very high. Now, we have a population in Trinidad of 1.3 million. We have approximately 200, perhaps more, 1,000 persons with diabetes, different stages, different types, different kinds. Can you go into explaining some of the details for us?
Thank you. As we know, diabetes is a condition where we have higher than more blood glucose in the bloodstream, more than what the body needs. Mm-hmm. And this happens usually because one can have less insulin or resistance to the insulin. There are two types that we are aware of, type 1 and type 2 diabetes. And 90% of the diabetics or persons with diabetes tend to be the type 2. And it's an epidemic in many countries, under-recognized and particularly underfunded. specifically talking about diabetes and the eyes. And as you rightly pointed out, the prevalence in Trinidad and Tobago is roughly about 11 to 15%. And in fact, the NEST study, which was done in about 2015, published in 2017, showed about 19 to 20% prevalence of diabetes, and of which a significant number of people led to having blindness because of diabetes, because it's a silent disease and the damage takes place without one being aware of what's going on within their eyes. When there is excess blood glucose, it causes damage to the little blood vessels throughout the body. And this particularly is visible as its initial changes within the eyes. And that's why eye becomes a very pivotal point in identifying changes that goes on in your body.
But in terms of our situation here in Trinidad and Tobago, we say 10 to 15% of persons with diabetes. Now, you said that the greater portion is type 2. Explain what is the difference between type 1 and type 2?
Type 2 is the condition where one tends to get problems with their blood glucose for various reasons, such as sedentary lifestyle, one being obese, or overweight as we call it, tending to have a stressful lifestyle, and these kind of activities tend to contribute to type 2 diabetes compared to type 1, which most people are born with because of impact to the insulin secreting cells within the body by an autoimmune system.
So what you're saying in effect that diabetes type 1 will affect persons as children to start
Correct,
with?
yes.
Because I know a long time when you heard somebody say they have sugar, well, we used to call it sugar in those days.
Correct.
You associate that with elderly people, haven't completed living a nice life, a full life, whatever. But now we're seeing it is spread across the board, across the spectrum.
You're absolutely right. And it doesn't spare any population as such. It can affect everybody and anybody. And the predisposing factors, as I said earlier on, is somebody who's overweight, sedentary lifestyle. But what we have found out is that one can have the genetic traces which predisposes you to having diabetes, but the environmental factors, that is the way we conduct ourselves with our food habits, contributes to it much more than blaming genetics or any other patterns that contribute to the problem.
Let's look at some of the symptoms, because a lot of people still continue to live in denial.
Yes.
They tell themselves that, good man, I'm okay, But the symptoms are there with them, but they feel that, well, for example, you want to drink a lot more, you are advised to drink a lot more water, but you say it's because of the heat, but it may be because of something else.
Correct, you're absolutely right. And the typical factors is, they say, if ants are migrating towards you, you tend to have much more blood sugar.
Okay.
So that's quite an interesting thing, which was used to be stated in many stories. But it's actually not a story. It is a fact, because there is excess sugar and things get attracted to various secretory products. But what is important to look out for is the usual symptoms of drinking excessive water, visiting the toilet much more than usual, eating a lot more than required. And as you rightly pointed out, drinking water is good, but always take into context where you live, whether it is a hot country, what kind of work you do. Are you doing a physical labor which is causing a lot of perspiration, which needs water replacement? But when we take that into context, we realize that in a lot number of the people, it may not be the case.
Okay. But in terms of other kinds of symptoms, are there many other symptoms?
These are the usual things, but from the eye point specifically, what happens is, as I said, it's a silent disease. People tend on to developing slow changes with their eyes. And one of the particular things that we notice but under-recognized is the frequent change in their vision. And this is because there are some changes taking place within the eye, such as the lens. And then one of them tends to visit the optician, and usually the optometrists tend to examine the eyes and find some changes which are early on at the back of the eyes. And that usually would be the start of a journey for an individual for type 2 diabetes.
But I mean, it can affect the eyes to the degree where it can lead to blindness. But if you take it early, you can also prevent.
Well,
Can
thank you for bringing that into the context now. Correct. Now, I said earlier on the blood glucose elevation damages blood vessels. And the structures that are affected are called as capillaries. These are thin little structures at the back, all over the body. But particularly within the eyes, early changes are what we call as biomarkers. When we take pictures of the back of the eyes or are able to examine the back of the eyes, we're able to identify these early changes. And once we tell someone that these early changes are there and you change your blood sugar or blood glucose level by improvement in your diet, exercise, etc., what you find is these little changes revert.
But you know what I find strange sometimes? People doing a lot of physical exercises, people doing a lot of, for example, athletes. Imagine an athlete falling down and you know, collapsing and all of that. But because you will say that this is not supposed to happen to them because of the fact that they're very active.
Correct. You're absolutely spot on. Physical fitness allows burning of the blood glucose adequately. Normally, unless you're born with diabetes, most athletes do not develop during their athletic career or sports career diabetes. But it's afterwards, if they slacken down completely and put on a lot of weight, there is a risk of that happening. But when you're very physically active, your body needs a lot of energy, and usually one does not develop unless you're born with diabetes.
One of the things about diabetes is circulation. Or one of the associate problems of diabetes is circulation or the lack thereof. How do they correlate?
Right. So blood circulation in the whole of the body is through blood vessels. We have large blood vessels and small blood vessels. Going back to what my earlier comment was, little blood vessels, where the damage starts happening, particularly with diabetes and raised blood glucose levels, is they start shutting down. Once these little blood vessels shut down, they cause damage with new blood vessels at the back of the eyes. They can bleed. These are microvascular changes or little blood vessel changes. But likewise, the bigger blood vessels can also undergo changes and result in changes like heart attacks, amputation, stroke, and various other problems that we see. And we can associate the two of them together, saying that when somebody has eye problems, we can say that what period will they possibly develop some changes within their body as such.
Can somebody get diabetes or have diabetes along with other eye conditions?
Very, very interesting question. Yes, they can. They can have diabetes independently, and they can have other conditions such as glaucoma and have coexisting diabetes. Diabetes can contribute to a lot of other eye diseases. Again, related to blood circulation, they can damage the nerve supply to the various muscles in the eye. Then it can contribute to cataract formation. They can contribute to glaucoma, and they can also cause what we call as new blood vessels in the front of the eye, which causes loss of eyesight, painful redness in the eyes, which leaves an individual with very, very poor eyesight in that particular eyes.
Is it reversible at all?
Diabetic changes are graded into different scenarios. As I said earlier, we have background diabetic retinopathy changes. That usually tends to be reversible if the blood glucose can be improved upon. But once they progress from having very minimal changes, it does not tend to be reversible completely, but the stability of it can be maintained if the contributing factors, apart from the blood glucose, is the blood pressure and lipids, that is the cholesterol in the body, can be maintained. The situation can be stabilized to a certain period of time.
So you can maintain your health with precautions.
Absolutely spot on. Yes, you can, particularly blood glucose, we specify that not your routine and daily blood a sugar level measurement. It is useful to know what we call as the HbA1c, which is a 3-monthly blood sugar assessment, which gives a person with diabetes a good idea of their control, which would be a measure of how well they have managed to use their diet, their physical exercises, and various other things to stabilize themselves. And they also find that they can come off medication if they improve their blood glucose levels with time.
What I noticed too is that sometimes your figures keep jumping up or it keep coming down.
That is so true, actually. That is so true. The blood glucose level can vary with many factors. Of course, we know what is called as fasting blood sugars. We know what is called as postprandial. That means something that is evaluated 2 hours after blood sugar assessment.
Right.
Random blood sugar, that is evaluating blood sugars at any point of time. Then the 3 monthly blood sugars we are aware of. But stress, poor diet, lack of exercise, all contributes to up and down variation in your blood sugars.
Okay, so
We hear a lot of diabetics not reaching out care. We are unable to comment about the fact as to what the situation was pre-COVID to what is the situation
now.
post-COVID.
Okay.
Simply because the number of patients we see are pretty much the same, but definitely we are increasing the number of people that we're screening. We probably will have a better understanding with time whether there was any shift between the two periods.
now there are a lot of people who have a lot of advice on what to take, what not to take. Even some of the drugs that are prescribed, sometimes you hear complaints by people that this is not working for me. You know, in terms of well, I don't want you to name any product or anything, but is there a distinction between the right drug and the wrong drug?
So this is interesting. I think I have to don the cap of what is called as a medical doctor out here. So because I'm an ophthalmologist, I've been in ophthalmology for a long time.
Right.
Maybe my medical knowledge is slightly different. But being interested in diabetes and in persons with diabetes and the implications it has, I would segregate it as two things. One is what can you do simply, which is to prevent the problem, and that is about diet, and making sure that you eat the right kind of food and exercise the right kind. And because diet has a huge bearing on how you function, and it has a 70% bearing on your weight and overall functionality. And as we are aware, within Trinidad and Tobago, there's a huge population who are overweight, and particularly with the WHO data, which showed about 60% having overweight and 40% being obese. And unfortunately, women seem to be higher in this record compared to the men in Trinidad. But coming back to the prevention component of it, these are adjustments that we can all do. The component of where one needs some support with medicines, I think I would leave it to my colleagues who are physicians, who tend to capably advise based on an individual requirement. And my belief is that anybody who has a medical problem like diabetes need to have individualized care by their own doctors. And also, the most important thing is for them to take charge of the problem. Because unless you take ownership of it, you're not going to sort these things out. The only reason why I say this is my father is a diabetic. And when I asked him initially as to, do you take any medicines? When I understood what diabetes is all about, oh, I take that little pill. And that is what it is. And I don't think I have diabetes. And this is how I was told. And he's been a diabetic for about 45 years.
Now, that's an interesting one because you've heard diabetics saying that I've had this condition for ages, decades perhaps.
Correct.
But I still survive.
Well, that is the interesting part with diabetes as such. It's a chronic disease. It comes under what we call as non-communicable diseases.
Right.
And governments around the country utilize the non-communicable diseases department to care for diabetes. And as you rightly pointed out, it's a disease which damages with time. And what we see from the eye point of view is that anybody who's been a diabetic for over 10 years, we tend to find changes at the back of the eyes.
Okay.
And the longer these people tend to have diabetes with poor control, the damage tends to be worse off. And a longer period of time, there are other serious problems, and with particularly men, and there is a huge impact with what we call as erectile dysfunction as well, because they affect the blood circulation. And nobody talks about these things, and it's important to raise this subject throughout our communities. And my interest is whether we can broach this subject as a dinner table conversation and ask ourselves and the children, what can we do as families, as communities? Can we change the approach towards how we eat and what we eat?
I just want to get back to this, the potency part of it, because from the time somebody finds out that they have diabetes, they tend to lose interest in things, emotional, sexual, etc. Both men and women. Although the men will feel that they're more macho and they could try something or do something, the women tend to be a lot more withdrawn. I mean, this is from talking to people over time. You understand? And people want to know, well, do I continue living? How do I treat with this? You understand? Because they feel like the manhood, especially with men, they feel like your manhood gone.
This is interesting what you bring about. As I said, again, that's out of my remit of influence to
Yeah,
understand.
but since the topic came up.
Yeah, but diabetes has several implications. We've spoken about the eyes. We spoke about other systemic problems. One of the other big areas is depression, which comes up in diabetes. And what's important to understand is seek out help. There are opportunities to seek out help and work towards improving your blood glucose levels. And a lot of things are reversible. And as you rightly pointed out at the beginning of the program, prevention is better than cure.
Right.
So early awareness of the issue. If you find that yourself having some symptoms which might be related to diabetes, seek attention at the earliest possible.
And just don't continue to live in denial.
No, that's the key thing. The key thing is accepting the issue, don't live in denial. A lot of things can be done. And coming to the eyes particularly, get your eyes screened on an annual basis, because a large percentage of the problem can be picked up very early on. And the best part of it is that you can avoid getting blind unnecessarily. And this is a big area of preventable blindness. And diabetes and glaucoma are two main reasons for blindness in Trinidad and Tobago.
Well, that's a very important area to note, or situation to note. And it gives us a good time to take a break for our worthy cause. We'll be back momentarily as we continue our discussion. On the program, Taking Care of Your Eyes. This is a special 1-hour program here today on Mended Studio. It's with the assistance and the support of the Trinidad Eye Hospital. Of course, it's also with the collaboration of PAVI, Persons Associated with Visual Impairment. And I am your host, Bawani Prasad, taking you through the paces, so to speak, and of course, with the goodly doctor from the Trinidad Eye Hospital. Let's divert a little bit and talk about Trinidad Eye Hospital and the services you all offer, because people go to eye clinics, people go all over the place to get treatment, but the work of the Trinidad Eye Hospital and the CVRS, I know your colleague is more into CVRS than you are, but based on your experience here in Trinidad, tell us a little about CVRS before we go back into the meat of the matter.
Good, okay. CVRS is Caribbean Vitreous and Retina Surgery Limited, a company formed by my friend. We trained together in England, so that was the reason why our collaboration has taken forward to me traveling down to Trinidad. So this he put together in about 2010 and has been functioning as a main for-profit organization. But in about 2015, 2016, with evolution of the way he was delivering things, he felt that there was a need to do more, and the idea of a not-for-profit organization came up. And that's why the Trinidad Eye Hospital was given birth. And Trinidad Eye Hospital focuses on, again, a lot of activities within the community. And the primary one, which he got me involved in, the diabetic eye screening program. We put together a program, and we have been doing this since March 2018. It's purely because I had some experience in diabetic eye screening where I worked in England. And we also do programs such as charity surgeries, and looking forward to it is on the December 14th, we will be doing charity surgeries where we would be operating on cataracts and also vitreous surgery, largely for people who are diabetics who cannot have who have economic challenges in meeting the cost of the surgery as such. So yeah, a lot of activities, and we're also looking at working with children to provide them support where spectacles are needed. But a large part of these activities are funded by our main parent company, which is the CVRS, where we give comprehensive eye care. We provide care in cataracts, glaucoma, and largely we are experts in retina, and we deal with the outcome from the diabetic eye screening program within our organization. And we run this organization currently in the newest site in Masca Compound in San Fernando, Freeport, St. Augustine Clinic, and in Maraval. That's where we run these clinics at this point of time.
Well, that is highly commendable. Any numbers you want to leave with the listeners, viewers?
So the diabetic eye screening program contact number is 687-3377.
Okay, 687-3377. Now, I want to go back to the eye screening program. What can a client who visits your facilities expect or go through when they come for eye screening?
Wonderful. Thank you for asking that very particular question, because most people are scared to attend an eye screening program. I would add to say that it's the most pleasurable experience, having overseen this program in the past in the UK, but here also. So anybody who's a person with diabetes over the age of 12 years can get access to this screening program. We have a wonderful collaboration which we have done with Diabetes Association of Trinidad and Tobago since the MOU was signed on the 8th of October. That's the World Sight Day. And this year.
As early as this year.
As early as this year. And interestingly, with this month being the Diabetes Awareness Program, in fact, our team performed the screening program in Point Fortin today.
Okay.
So where they have seen about 37 people in the whole day. And on Monday, they were in Faizabad in the south. Last week, they were in Tobago.
So they're taking it throughout the length and breadth of the country?
Correct, actually. They are taking to the length and breadth of this country and also to Tobago. We performed one session in Tobago last week with the police service, and we're working with the regional corporations.
In terms of reactions from people, when you screen their eyes and you say, well, look, I see that XYZ is the situation with you, how do they react? Do they adopt an attitude, well, maybe today is today, tomorrow is tomorrow, or are they concerned to say, well, look, I am going to take more careful stock of the situation? Or basically, families, especially families, spouses, they tend to say, well, look, you look like you're losing your sight, so I go on.
Right. Okay. So it's interesting you brought about the reaction of an individual. But before I step into that, I'll just take us quickly through the process of the screening.
Right.
Anybody over the age of 12 can access. When they come in for the day, for the program, we do ask them to give themselves at least 2 hours because their eyes will be dilated. When they arrive, there will be a medical history taken. Once the medical history is done, then we do the vision testing of the individual. Then drops are put in to make the pupils big. And then we take serial photographs of the back of the eyes. Once we've taken photographs, we upload all these photographs onto a software, which we go through afterwards to do the grading of these pictures. And based on the level of diabetic retinopathy, we advise the individuals whether they have no changes, where they have minimal changes. In these two situations, we tell them we will see you back in 12 months' time.
Okay.
If they have minimal changes, we probably see them in about 6 months' time. And if they have got significant changes, then what we tend to do is advise them to come into the eye clinic.
Okay.
Okay? When they arrive into the eye clinic, let me be honest, having seen a lot of these persons with diabetes, they're scared. They're scared that they will lose their eyes because the damage to the eye is significant. And the first thing that we have to try and do and understand anybody in that
Is
situation.
to walk them through it.
Yes, that's exactly what we try and do. And we try and help them understand because we have pictures accessible within our system in the clinic. We take the individual and the family through the various changes that are taking place at the back because there is nothing more powerful than pictures and scans that are done at the back of the eyes. Once we demonstrate to them what's going on, if the individual requires any treatment, and the treatment can be along the lines of injections in the eyes, whether laser treatment in the eyes, and in the worst case scenario, whether they need some surgery at the back of the eyes, then we talk them through about what needs to be done and support them through this program.
So there's support all the way.
Absolutely support all the way. And currently, where there are challenges in providing them support, we seek out partnership with our partners in providing care alongside the TEH. But if, in spite of all these treatments, we are unable to provide any improvement for the individual, we seek out organizations like yourselves, where they can be supported. Because I do not believe that somebody who's visually impaired needs to be left alone. They can conduct themselves independently as long as we demonstrate that there is support for them.
Like I always say, there's life after blindness.
That is true. I'm learning that much more through y'all.
Very good, very good. Well, what we're going to do, we're going to let people know of the numbers, 337-6709. We do have a few minutes. I'm not sure what our time is looking like, but I'm sure the discussion you found thus far very interesting, very informative. So as we await your call, let me remind the persons that PAVI will be having a Christmas fundraiser. It's called a Curbside Pickup Luncheon. Food again, Doc?
I'm listening to you, actually.
Right. It's going to be on Sunday, December 6th from 12 noon to 2:30 p.m.
Okay.
At 3 locations. We're going to be having the location that's downstairs PAVI's office, Campus House, St. Augustine. We also have the Princess Elizabeth Center for Handicapped Children out there in Aripita Avenue in Woodbrook. And we want to say thanks to the RC Church in San Fernando. So, you know, we're not leaving out anybody. And the meals can be collected between 12 and 2:30 p.m. You can visit PAVI's Facebook page for further information. And I'll tell you, it's a Christmas meal, a dessert, plus a drink, only $200. It's a fundraiser, but it's for a worthy cause, one, and the food is always sumptuous. So that's on Sunday, December 6th. So you just come, you pick up. Now, what we prefer people to do is to call the office at 220-1073 and pre-book your order. So when you come on the day, you wouldn't have to be lining up and waiting and in the hot sun or wherever. And remember, social distancing and all of that still has to be observed. So we want you to pre-book your order. It's either a choice of chicken or fish, ham, turkey, you know, whatever you choose. But you can call PAVI's office for further information. You can check our Facebook page. The menu is there, and you can make your order. We have different forms of payment. You can pay by check, you can pay on the day, or you can pay through our bank account. We would love people to pay through our bank account so that we don't have this situation where we are stood up and we have food on our hands, or where you come and you get no food and you get disappointed. So we want to do this in a systematic manner. We want you all to pre-book your order. You have until 2 p.m. on the 2nd of December to do that. And then we tell the caterer, look, we want X amount of chicken, X amount of fish, X amount of this, X amount of that. So when you come on the day, you will be pleased, you'll be satisfied, and you'll go home feeling a sense of, you know, belonging to an organization that cares. It is under the patronage of former First Lady, Mrs. Celia Hassan Ali. And as I said, we have 3 locations, St. Augustine Campus House, Princess Elizabeth Center on Aripita Avenue, and of course the RC Church right there on Harris Promenade in San Fernando. So that's something to look forward to on December the 6th. I should tell you that thanks to Mended Studios and some kind sponsors, we will be having a virtual concert in the Christmas concert in the month of December. And on that show, we'll be giving away a couple items too. So come prepared to watch and to participate as fully as possible. So that's something you can look forward to with Mended Studios and PAVI in the month of December. We do have an extra program in December with Eye Hospital and PAVI as well. And we're going to be doing that program on December the 3rd. In case you didn't know it, December the 3rd is the International Day for Persons with Disabilities, which has been designated by the United Nations since 1992. So we will be using that day to talk about disability issues, focusing mainly on blindness. So that's something to look forward to on December the 3rd. And we are really happy. And, we deem it a pleasure and an honor to work with the folks here at Mended Studios. And, of course, for this two-part series, paid for by the Trinidad Eye Hospital. So let's get back into the meat of the matter. I don't know if we have any calls or if we have to keep talking, producer.
Currently, there are no calls at this point of time. We will continue to provide them the information that they want.
Okay, well, Doc, since you have all the information, I don't know stored where, in your memory or where, but what it is you want to share with us that we have not touched on as yet. Maybe we can develop.
I think the main thing that I want us to talk about is the screening.
Right, let's go back to screening.
Let's go back to screening because the power of screening is phenomenal. The reason why I say it's phenomenal is I've been part of two kind of programs within the UK. Digital screening program. What do we mean by that? We are using what we call as fundus photographs, that is pictures of the back of your eyes, which tells us what is going on, because these are repeatable and also can be stored. And if there is improvement in somebody's eyes when a current picture is taken, they can show the difference from the previous to now.
Okay.
So the power of fundus photography and assessment through it is wonderful. And that mechanism that has been put in place and reaching out to our persons with diabetes and reaching out to 80% of them, if possible, would be the way forward to try and reduce blindness from diabetes.
Now, I've heard it said that, blindness, 80% of blindness is avoidable.
You're absolutely spot on. And I think I would use the 80-20 rule.
Right.
For 80% of the people, you need 20% of the resources. And these are the well-behaved persons with diabetes. And for 20% of the people who are poorly behaved with diabetes, you need 80% of the resources. So it's quite interesting when you look at this. And some of the information that is looked upon within the UK or within Trinidad is the cost that the diabetes it has on the health system.
On the health system.
Because it's not just eyes. There are kidney damages, there are strokes, there are heart attacks. And what we did...
And the loss of limb, we can't forget that.
Without a doubt. And as I said earlier on, we have a situation where one does not have any retinopathy changes, one have little retinopathy changes, one have significant retinopathy changes. And we found that when we did a study, the significant retinopathy changes, 50% of them within 2 years developed loss of limb, had a heart attack or a stroke. And this is all preventable.
I want to come back to screening because I know that we having had experience of meeting different persons from different parts of the world, that there are two types of charts which I use, the
Snellen chart.
Snell chart, sorry, not smell.
Yeah.
Snell, and of course the Logma chart.
Correct.
And the Logma chart, in my humble opinion, proves to be the more accurate of the two charts. Is that a true thing, or?
It is. What we use both of them, and they are pretty good depending upon the situation and the need for it. And as you rightly said, research has shown that Logma charts, when done in the right setting, they use, and the contrast settings are right, it tends to predict the vision much better than the Snellens. But they are equivalent and not to be compared between the two of them.
Right.
Because Logma
they both have a role to play.
A role to play, and the functionality of it is very important. But when we talk about screening for diabetes, it's not just the vision check, it's the fundus photography, which is the key thing for diabetic individuals.
Retinopathy.
Yes, retinopathy. And it's detecting of what we call as microaneurysms at the back of the eyes.
Okay.
These are the earliest changes that one sees at the back. If you see that change and if you improve your blood glucose level, then those little microaneurysms can disappear. But if they're allowed to get worse, then they cause problems such as bleeding at the back of the eyes. And once the bleeding starts at the back of the eyes, all it does is scarring, or what we call as, just like we have scarring on the skin,
Right.
it causes the same with the retina. It lifts it up and contributes to loss of eyesight.
Okay.
So we within CBRS actually do retinal surgery to try and put this retina back in place. And largely it's a complex surgery that needs to be done. And what we wish and hope is that not many people end up needing that kind of intervention in the long run. And we found this happening in the United Kingdom, where a lot of work has been done with screening and the impact of screening. At once upon a time in UK, amongst the working age population, diabetes was the commonest cause for blindness. And now it has dropped down to number 3 because of screening. Screening has made a tremendous impact in reducing blindness, largely in the population that we're talking about within the UK.
I'm glad you mentioned that, because I think throughout my discussion in the Caribbean here, we have continued to advocate screening, especially for school children at various points in their life, from 0 to 5, from 5 to 12, from 12 to 17, and even beyond, because of the fact that some of them go on to university and tertiary education, and could maybe developing some symptoms during the course of life that is now becoming more and more prevalent.
So screening, what you're talking about, particularly with the education system or school children, is not particularly focused on diabetes.
No. It's a generalized
general screening as such, yes.
But
that is, once the system is embedded properly, as you rightly pointed out, it would be fantastic to extend that to the adults. And as I said, over the age of 12 years, one who is a diabetic needs to have their eyes screened. Why we talk about so much about screening within the Trinidad Eye Hospital is that we probably have managed to screen in the last 2.5 years about 2,500 to 3,000 people. We have detected problems in a significant number of them. And as you rightly pointed out earlier on, there is a lot of people, there is anxiety, there is panic amongst the people who are detected to have advanced diseases.
Right.
But how do we grow this? That's the next important chapter to talk about.
Well, we will talk about that. We do have one more break to take in the program.
Yes.
So let's rest our voices and let the technical people do what they have to do.
Absolutely.
We'll be back in a moment.
Are you looking for the best meaningful and affordable gift you can ever give someone or yourself for any occasion that will last a lifetime? Check out God's Gifted TT for your very own poem and bookmark. Your gift can be received via TT Post, email, or we can arrange a pickup area. You can contact this business on Instagram, Facebook, email, and sign up for the form on Linktree. Contact them at 354-1956. 354-1956.
Welcome back, everybody. Clock on the wall going on to 46 after the hour and counting here. We have about 13 and a half minutes on the program, and we still have a lot to share with you on screening, Doc. The importance of screening and why we need it and what the clients must do or mustn't do.
I think if there's any single message that we would like to convey through this program, if you're a person with diabetes, get your eyes screened, because it has the power to actually identify changes which might make a difference to your complete life.
Right.
Particularly losing your eyesight, damage to other parts of the body can be picked up very early on. And we would work with you to try and assist you to continue to be independent as much as possible.
Yes.
And that would be the biggest message.
Right.
So my challenge now is how do we grow with screening as such?
Right.
And that is something that I would like to bring to this platform.
Sure.
What I see is, having worked in a national program within the UK, we in Trinidad should have a national program which allows us to care for all the persons with diabetes throughout the country, where we can have screening on a 6 days basis in various locations where people who do not have the ability to travel can access the service.
Something like what you did over the last 2 weeks or so.
Absolutely right. We have learned that we, by traveling, have identified a lot of people who would like to come and access similar kind of services. But in collaboration with the government and all the relevant stakeholders, we would like to run and support a national screening program to develop a national register for the diabetes persons, which allows them and the other providers and supporters for care of individuals access to information where we can target the support individually and never to forget that. Because unless we individualize care, we're never going to reach to the target population. And this can affect anybody, your family, your neighbor, your friend, and yourself. And that's important. And unless we take measures now, we are not going to get over this problem. Because I started off by saying we have a prevalence of about 11 to 15%, which adds up to about 200,000 people. And this is somebody we know. A lot of people are something called as pre-diabetics. We have another 200,000, which simply means that 1 in 3 persons or 1 in 4 persons in Trinidad are potential diabetics.
Wow.
And that is scary. That is scary. I mean, I love food. I don't say I don't like food.
Well, we all do.
We all love. And you just said a lot of things that we do is related to food. But how do we challenge that? How do we sort that out? And how do we handle that urge to eat food? How do we manage ourselves with the environmental influences that we have is very, very, very important. So screening, not just what we do in Trinidad Eye Hospital. We wanted to grow with all our partners. We have an understanding with Diabetes Association. We want to support them in the access that they have with various organizations for the persons in diabetes. Government support, PAHO support. We have several organizations who do make a massive difference. Lions Club, Rotary Club, World Diabetes Federation, International Diabetes Federation. So you see a lot of players are existent in the what we call as the framework to support persons with diabetes. But we all need to join our hands to make a difference.
Right. Which is extremely important.
Yes.
Which is very, very important. Now, in terms, I want to go back to the stats a little bit, but because I know, is there a higher degree of diabetes among the the elderly population as against the working people population as against the younger generation?
A very, very interesting question. As I said earlier on, we have data, again, I'm using the data from United Kingdom.
Yeah.
Yes, significant number of people are in the working age group. And currently coming from data from the world across, particularly from India, you tend to see the epidemic of diabetes exploding in under 30s.
Okay.
There's a huge amount of personnel. Again, it is environmental influence. You come out of graduation, you start working, you want to grow in life, sedentary lifestyle, you're stuck behind the desk for long hours without getting up to doing any exercise, just munching on something that might be provided to us. And how products are sold to us in a very appetizing fashion, because that meets our expectations. Reach out to a bottle of sugary drink, whatever it might be.
Right.
It's the easiest way to feed ourselves.
Right.
Without naming names, these are the areas that can cause complications. Without knowing, you've caused enough damage to your body, and your body retaliates. And that's how we manifest the other problems of diabetes.
But in terms of diabetes, say when you, like if a sugar drop or something like that, you need to take a sweet. In moderation, of course. In moderation.
Correct.
Right?
Yes.
So that is a true thing.
Yes. I mean, once you have diabetes, it is a different problem. One needs to understand the implications of having elevated blood glucose levels versus low blood glucose.
Right.
Because when you have low blood glucose, you can have impairment of blood circulation to organs like the eyes and the brain, and you can collapse and damage yourself and also precipitate heart attack.
Right.
Likewise, if you have very high blood sugar, you can again cause damage to your body, such as the brain, and you can go into comatose state, and you can take a lot of time to recover. So extreme ends of the spectrum cause significant damage. And even running up and down the blood sugars causes significant damage. And we see that within the eyes when one develops what we call as spoke-like opacities within the lens. These are called as cataracts. And when I see somebody who is diabetic and I see this changes within the eyes, I'm able to tell that this individual has poor control of diabetes. And I do have a conversation with them as to how they can support themselves.
We have two major ethnic compositions in Trinidad.
Correct.
Is diabetes more prevalent for one against the other?
Again, a wonderful question you asked me. For a recent talk, I delved into this matter a great deal. And to put things into perspective, I would say genetic factors are like the gun, the environment is the bullet. So we are predisposed. There's no particular preference over one race over the other.
Right.
We are all at risk. It's just that the trigger of the environment, such as dietary habits, lack of exercise, stress, tends to predominantly affect one group more than the other. So that's important.
Okay.
I think one thing I've learned about diabetes, it does not segregate how economically rich or poor. It does not segregate any
no
race.
level of discrimination.
No discrimination of any kinds with
Right.
diabetes.
Right.
It's a very rich disease in the terms of blood glucose.
Well, as we get ready to wrap it up, do's and don'ts, very quickly.
First thing, I think once you know that you're a diabetic, get your blood sugar measured. Important, become aware of HbA1c, get that evaluated through the doctor. That would be good. Having a doctor rather than monitoring yourself would be a good way forward. Check your blood pressure, get it measured and recorded. Maintaining a record of this helps you understand how improvement is happening. Get your cholesterol checked out. Important, do not forget to get your eyes screened for signs of retinopathy annually. Listen to your eye doctor if there are changes, because eyes are very powerful in showing some changes, and improvements that you make with your blood glucose levels can be shown within the eyes as well. Get your feet checked out. Make sure your kidneys are always evaluated. Your weight is checked and waist measured, because it's important to use that information to understand what kind of parties you can have and what kind of foods you can eat. If you smoke, seek out support to help you quit, because smoking does not help diabetes. It contributes to damage to blood vessels.
Right.
A care plan review along with yourself, your family, and also your healthcare provider is very, very important, because without a plan, you're not going to be able to do it individually. You're the driver and it's individual care. Access to local diabetes education is important because there's a lot of opportunities available through the World Wide Web. If you are a child or a young person, speak to the diabetes pediatric healthcare team. They will give you some specific information. Continue high quality diabetes care when you're in the hospital. And special emphasis, I would say, is to women who are planning to have a baby. They are at particular risk for worsening of their diabetes during the stress of being pregnant. But they can always be pregnant. They can need to be looked after by the doctor and their obstetrician. Seek out help. And we do emphasize that anybody who is pregnant and diabetic need to get their eyes checked out regularly. And help from specialist diabetes healthcare professionals to manage your diabetes. Last but not the least, emotional and psychological support is a very important component. Depression is underappreciated in diabetics. I think we need to emphasize to them that they are not on their own, and this happens to a large population. Currently in the world, there are known 450 million diabetics.
Wow.
And this is currently going to grow in about 10 years to 650 million. We are dealing with a serious problem out here. Unless we change our attitude, we are not going to make a difference.
Yeah, the whole question of attitude comes into play because some people say, well, look, I have diabetes, I'm feeling good, I could take a drink, I could, get excessive, get wild, but what we always advocate for is moderation is the name of the game. And as we always say, an ounce of prevention is better than a pound of cure.
Absolutely. I do not ask you to change your lifestyle, but I would ask you to emphasize on the quality of your lifestyle, which would make a difference to entertaining and enjoying your life. Enjoy your life, that's the key thing. But just make sure that a little bit of attention to various parts of your body allows you to continue enjoying for a long period of time. And we at Trinidad Eye Hospital are happy to support you all, help you all, and care for you all with regards to your eyes.
And just to caution, people can acquire diabetes very early and live a full life. It's not like some other diseases which take you rapidly, to the beyond, so to speak.
Absolutely spot on. I know a lot of people who live a happy life with no changes in their eyes as they have bothered to care about themselves. And their family has been very supportive. So seek out help.
Right, and we have to seek out of the studio now because our time is almost up. Let me again say a special thanks to the contributors, the Trinidad Eye Hospital, for spending this two-part series with us. We hope we can do many more of these in the future. And remember, the Eye Hospital is there for your asking, your service. Call them and to get some more information and treatment and screening, etc. Let me thank also the people at PAVI, Persons Associated with Visual Impairment, who are coordinating this program and also being part of the whole system. And of course, we cannot forget the platform which we use, and that is Mended Studios. As I said before, we have two special features coming up in the month of December right here on Mended Studios. The first being on the International Day for Persons with Disabilities, and the second, a Christmas virtual concert, some entertainment. So it's not just all talk, but some good entertainment. And until the next occasion when we get it together again, my name is Bawani Prasad, thanking you for listening, for viewing. And remember, as we always say, an ounce of prevention, and we cannot help repeating it over and over. An ounce of prevention is always better than a pound of cure. And remember, moderation is the name of the game. Thank you. Be good. God bless. And take care.
Of importance. I'm not expert at this, but I'm a victim of circumstance. I hope you take me seriously and you would react